has gained international recognition of its experience in handling Ebola outbreaks over the years. The country has developed strong surveillance systems and rapid response teams, plus public health emergency mechanisms that have helped contain severe outbreaks. Now, health experts believe that this expertise places Uganda in the unique position to assist neighboring countries during health emergencies. Plus, the World Health Organization has repeatedly emphasized that infectious diseases do not respect the borders. For this reason, collaboration between the countries is considered one of the most effective ways to prevent the widespread outbreaks and protect the populations. Now, health authorities continue to encourage members of the public, especially those living in the border districts, to remain vigilant, and anyone experiencing symptoms associated with Ebola should report immediately to the medical attention and avoid contact with others until they are assessed by the health professions. And also, officials also remind the public that maintaining proper hygiene, washing hands regularly, and avoiding contact with the bodily fluids of sick individuals and reporting suspected cases promptly remain essential measures in preventing the spread of Ebola. Now, the deployment of Uganda's medical team demonstrates that the country's commitment to the regional health security and highlights that the importance of solidarity in responding to the public health emergencies. And by working together, health experts believe that countries in the region can reduce the impact of outbreaks and save many lives. So, Ebola remains one of the world's most dangerous infectious diseases, but experts say that early detection, rapid response, and strong regional partnership can make the difference. So as Uganda extends a helping hand to the neighbor, the goal remains clear: stop the outbreak and protect communities, plus also save lives. Now, moving on from our Ebola story, community health remains one of the most effective tools in preventing disease outbreaks, and in Buganda Kingdom, leaders and health experts are working together to ensure that communities have the knowledge needed to protect themselves from some of the country's most dangerous diseases. Now, Buganda Kingdom has intensified its efforts to combat the preventable diseases through community health campaigns, with residents of Busujju County receiving specialized training on disease prevention, hygiene, sanitation, and outbreak response. Now, the health sensitization training was held at Malangala Health Center 4 in Malangala Sub-County and brought together village health teams, health workers, local leaders, and also representatives from the Buganda Kingdom. Now, the initiative is part of the broader campaign aimed at strengthening grassroots health systems and improving community awareness about the major public health threats. And the program was organized by the Buganda Kingdom through the Ministry of Social Development in partnership with the Office of Nabagereka and the Ministry of Health. Participants received training on how to prevent and respond to diseases such as malaria, HIV, stroke, AIDS, Ebola, Mpox, and other infectious illnesses that continue to affect communities across the country. Speaking during the training, the second deputy County Chief of Busujju County, Salongo Sabalamu Henry, praised the Kabaka of Buganda, Ronald Muwenda Mutebi II, for prioritizing the health and well-being of his people through community outreach programs. And he noted that bringing health educators closer to communities is helping residents better understand how these diseases spread and what steps can they take to protect themselves and their families at large. However, he expressed concern about the continued burden of the preventable diseases in some parts of the country, especially in communities around the Lake Wamala. And according to the local leaders, malaria and HIV stroke AIDS remain among the biggest health challenges facing residents despite the ongoing campaigns. Health experts at the training emphasized that many illnesses can be prevented through the simple but effective measures such as sleeping under treated or insecticide-treated mosquito nets, maintaining proper hygiene, washing hands regularly, and keeping homes and the surroundings clean, and also seeking medical attention as soon as the symptoms appear. Now, the chief of Malangala sub-county, Dungu Edward Nyoni Ntono, called upon the community leaders to monitor the use of mosquito nets distributed to households. He said that the nets are intended to prevent and protect the families from malaria and should not be diverted to other activities people engage in. So malaria remains one of Uganda's leading causes of illnesses and death, particularly among children under 5 and pregnant women. Health officials say that proper use of the mosquito nets can significantly reduce the infections and save many lives. So representatives from the Ministry of Health also highlighted the important role played by the village health teams, commonly known as VHTs, that these community volunteers can act as the first point of contact for health information and are often the first to identify disease outbreaks within the communities. Now, health educator Abdallah Kayongo encouraged the VHTs to continue educating households about sanitation and disease prevention and the importance of seeking treatment early rather than relying on self-medication. Meanwhile, David Muwonge, the health coordinator of the Ministry of Social Development and the Office of Nabagadeka, urged communities to remain alert against the emerging health threats such as Ebola and Mpox. He stressed that fighting diseases requires collective responsibility and adding that communities must pay attention to the health messages, report suspected cases quickly, and follow the guidance from the health authorities whenever the outbreaks occur. And participants also pointed out challenges affecting the community health programs, including inadequate equipment and limited resources for carrying out disease prevention activities at village level. And despite these challenges, health officials remain optimistic that continued community engagement, health education, and strong partnerships between cultural institutions and government agencies will help reduce the burden of the preventable diseases and improve the health of communities throughout the Buganda Kingdom. So, health experts say that disease prevention begins at home, and simple actions such as maintaining good hygiene, sleeping under mosquito nets, and seeking medical care early can save lives and strengthen healthier communities. Now, that's it from our story coming in from the Buganda Kingdom. Now, moving on to our next story. So Ebola remains one of Africa's most dangerous infectious diseases. Now the African health leaders are joining forces in a major effort to stop the outbreak before it spreads further across the continent. Now, African health authorities have launched an ambitious continent-wide plan to strengthen the preparedness and response efforts against the ongoing Ebola outbreak caused by the Bundibugyo strain of Ebola virus. Now, the initiative jointly unveiled by the African Centers of Disease Control and Prevention, commonly known as Africa CDC, and the World Health Organization seeks to raise $518 million to support countries across Africa in preventing, detecting, and responding to the Ebola outbreaks. Now, the 6-month plan, which will run from June to November 2026, comes as health officials continue efforts to contain the Ebola cases in Uganda and in the Democratic Republic of Congo. Now, the strategy aims to bring together governments, health workers, development partners, and local communities under a unified approach known as One Response. Health experts say that the plan will strengthen emergency coordination, disease surveillance, laboratory testing, infection prevention and control, clinical care, community engagement, research, logistics, and support for the essential health services. So the Continental Response Plan also complements the national Ebola response strategies already launched by the government of Uganda and the Democratic Republic of Congo. And speaking during the launch, the World Health Organization Director General Dr. Tedros emphasized that defeating Ebola requires strong partnerships and also coordinated action. He also noted that successful outbreak control depends on political commitment, adequate financing, and the active involvement of communities. Dr. Tedros stressed that communities must remain at the center of the response because the public cooperation is critical for effective contact tracing, early treatment, and preventing further transmission of the disease. Now, the Director General of Africa CDC, Dr. Jean Kaseya, described the outbreak as a challenge that demands urgency and unity across the continent. So he stated that Ebola spreads rapidly and that Africa must respond even faster. And according to Dr. Kaseya, the new plan provides a clear framework for African countries to work together, mobilize resources, protect vulnerable populations, and strengthen preparedness in the neighboring countries that may be at risk. And a major concern for health authorities is that there are currently no licensed vaccines or specific treatments approved for the Bundibugyo strain of Ebola. And because of this, experts say that early detection, rapid response, and community awareness plus strong health systems remain the most effective tools for controlling the outbreak. Now, the plan also places specific emphasis on strengthening country border collaboration, and countries have been encouraged to improve screening measures at border points, also enhance information sharing and coordinate public health responses to prevent the disease from spreading across the national boundaries. Now, the implementation of preparedness activities has of people toward hunger and malnutrition. So speaking recently, the acting executive director of the World Food Programme, Klaus Kau, described the situation as a perfect storm where the number of people facing the hunger is increasing at the very moment when the resources to help them are shrinking. And according to the World Food Programme, raising energy costs continue to drive up food prices across the many countries. And because food production and transportation plus distribution all depend heavily on fuel, increases in the energy prices often results into more expensive food. And for families already struggling to survive, higher food prices can have the devastating consequences. Health experts warn that when households cannot afford enough food, people are forced to skip meals, also reduce portion sizes, or rely on less nutritious diets. This can lead to malnutrition and weakened immunity, disease, and poor health outcomes, particularly among children and pregnant women. So the World Food Programme reports that millions of people in countries such as Somalia, Afghanistan, and many more are experiencing acute food insecurity and in Somalia alone, approximately 2.5 million people are facing serious food shortages, while millions more are struggling across other vulnerable regions. So humanitarian organizations say that the problem is being made worse by funding shortages, so as the cost of delivering aid increases and fewer people are receiving assistance despite the growing needs. Experts are also concerned about the long-term impact on food production, and in the parts of Eastern Africa, farmers are entering critical planning sessions while facing economic pressures and climate-related challenges. The reduced agriculture productivity could result in even greater food shortages in the months ahead. So the crisis is particularly concerning because hunger and health are closely connected, where we are finding that malnutrition weakens the body's ability to fight infections and also increases the risk of diseases and can slow physical plus the mental development in children. So the World Food Programme also highlighted the challenges posed by health emergencies such as Ebola outbreaks in the Eastern Democratic Republic of Congo, where Ebola response efforts continue and humanitarian workers are dealing with what they describe as a crisis within a crisis. Many communities affected by the disease outbreaks are already experiencing displacement, poverty plus food insecurity. And families placed under the quarantine or isolation often lose access to their livelihoods, making food assistance a critical component of the outbreak response efforts. Some humanitarian agencies are working alongside with the governments and health organizations to provide transportation, also logistics, emergency supplies, medical evacuation services, and food support to the affected communities. However, officials warn that one of the greatest challenges remains the growing funding gap. So the World Food Programme reports a significant decline in the available humanitarian funding, making it increasingly difficult to reach the vulnerable populations. So Karl Skau shared powerful accounts from his visits to some of the world's most affected regions, and in Afghanistan, he witnessed mothers working for hours with severely malnourished children only to find health facilities lacking the supplements needed to help them. And in Sudan, he visited massive displacement camps where hundreds of thousands of people depended on irregular food deliveries for survival. Plus, many families, he said, are left with little or nothing after the aid supplies run out. Health experts emphasize that hunger is not only a humanitarian issue but also a major public health concern, and food insecurities increases the risks of malnutrition, plus infectious diseases, poor mental health outcomes, and also the preventable deaths. So despite the challenges, the World Food Programme says it is working to improve the efficiency, expand cash assistance programs, also supporting community resilience and strengthening local capacities so that the countries can be more self-reliant in funding or responding to the future crises. So the organization is also calling for increased international support, warning that acting early to prevent the hunger is far less costly than responding after a humanitarian disaster has already been held. So as global leaders continue searching for solutions, humanitarian agencies stress that ensuring access to adequate food remains one of the most important investments in health, stability, and human dignity. So, hunger remains one of the greatest threats to the global health we are experiencing today. Experts say that tackling of food insecurity is essential not only for preventing nutrition but also for building stronger, healthier, and more resilient communities around the world. So that brings us to the end of your health updates today. I would like to remind you that good health begins with informed choices, preventable care, proper nutrition, plus community action. So we are going to look at a video of what really happened in the joint meeting for the Africa CDC plus the WHO against the fight for Ebola. So after there, we shall meet again tomorrow, and we are going to continue to explore the health stories shaping Uganda, Africa, plus the world. So until then, stay informed, stay safe, and stay healthy. See you tomorrow.
Plan for Bundibugyo Ebola virus disease. The plan sets out the regional risk, the priority actions already underway, and what it will take to stay ahead of this outbreak. A few practical points before we begin. The session will run for about an hour. All participants are muted. We will open the floor to questions after the remarks and presentations, and I will explain how to come in at that point. The session is being recorded. and we will share the press release and the full plan with you afterwards. We have 3 speakers today, followed by your questions. To begin, I am pleased to hand over to the Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus. Dr. Tedros, the floor is yours.
Thank you, moderator. Thank you so much. Dr. John Kaseya, Director General of the Africa CDC, Dr. Mohamed Yaqub Janabi, WHO Regional Director for Africa, dear colleagues, partners, and friends from the media. Good morning, good afternoon, and good evening, and thank you for joining us. Earlier this week, I returned from DRC, where I traveled to the epicenter of the Ebola outbreak in the province of Ituri. I saw and heard firsthand the challenges that the communities are facing and that the government and partners are facing as we race to control this outbreak as quickly as possible. The outbreak is moving fast, and we're still playing catch-up. But my trip to the DRC also gave me real hope that together, under the government's leadership, we can bring this outbreak under control. The only way we will do that is through government leadership, community ownership, and close partnership between the many actors on the ground. Today, WHO and Africa CDC are expressing that partnership by launching a joint continental preparedness and response plan. The objective is straightforward. We need to stop the outbreak where it is, support countries that are responding today, and ensure that neighboring countries are ready to detect and act quickly if cases appear. There are several important features of this plan. First, it's a shared plan. The only way to beat this outbreak is through close partnership, working together under the leadership of the affected countries in one coordinated effort, guided by a simple principle: one plan, one budget, one team. Second, this is a practical plan. It sets out what we need to do now together to contain the current outbreak and reduce the risk of future or further spread. Third, it's time-bound plan covering June to November this year. And fourth, it's a costed plan at $518 million. That figure represents the combined effort of Africa CDC, WHO, and key partners, including UNICEF, UNHCR, WFP, the AFRC, and FIND. Africa CDC and WHO are also establishing a joint financial tracking mechanism to monitor funding needs, commitments, and gaps. The plan focuses on core areas: emergency coordination, surveillance, laboratory testing, infection prevention and control, clinical care, and community engagement. It also provides for research logistics and the continuity of essential health services, which are often disrupted during outbreaks. Experience shows that success depends on how well these elements function together. Surveillance must lead quickly to testing. Testing must trigger isolation and care. Infection prevention must protect health workers and patients. And community engagement must be continuous, grounded in trust, and responsive to concerns. This plan builds directly on national response plans in the DRC and Uganda, where authorities are intensifying efforts to bring the outbreak under control. It also supports preparedness in neighboring countries where cross-border movement creates ongoing risk. WHO is engaged at all 3 levels to support the response. But technical work alone is not enough. Containing Ebola depends on political commitment, sustained financing, and the trust and engagement of communities. This plan places communities at the center because without their participation, contact tracing falters, safe care is delayed, and transmission continues. Misinformation is almost as dangerous as the virus itself and spreads just as fast. Earning and keeping the trust of communities is at the heart of everything we do. We're not starting from zero. This plan draws on lessons from previous Ebola outbreaks and recent health emergencies. Those lessons are clear. Speed matters, coordination matters, and consistency matters. The opportunity now is to act with clarity and discipline, using a common plan to guide a common effort. If we do that, we can bring this outbreak to an end and strengthen the systems that protect people from the next one. This is a serious outbreak, and it's one we know how to stop, but we need to move fast and together. No country faces this alone. As I said earlier, the key to this plan is partnership, especially between the Africa CDC and WHO. I'm therefore pleased to invite the Director General of the Africa CDC, Dr. John Kaseya, to say a few words. John, over to you.
Good morning, good afternoon, good evening. Dr. Tedros is so nice because I was even not planning to make opening remarks because my role today was to make presentation. But let me say, working together with WHO at HQ, at regional level, is what our countries they need, our communities they need. They are requesting that. Our partners they need. Ourselves, WHO and Africa CDC, we need because we are complementary. The leadership of Dr. Tedros at global level is guiding us, is inspiring us. All of us we saw when he was in Ituri, he had even opportunity to celebrate those who are out of this painful moment. This plan that we'll present today is a combination of plans from countries affected, from countries at risk, and from partners. And the process was supported by WHO, Africa CDC, and so many other partners. I want just to thank all of you, and especially WHO, for being today with us to launch this plan. I will come back later when I will make presentation, but let me, I think my brother, Professor Janabi, has some word to say.
It has slightly changed, so it's going to go after you, so you can.
Then Professor Janabi will speak after me. But no, let me first invite Professor Janabi, then I will come. Professor Janabi, over to you. As Tedros did to me, I do also to you.
Dear colleagues, can you hear me? Hello, can you hear me?
Yes, we can hear you, sir.
Dear colleagues, partners, and friends from the media, good afternoon, good morning, and good evening. Just 72 hours ago, I returned from Ituri. There I stood with Ebola survivors, listened carefully. They spoke of pain, of sleepless nights, and of the moments each believed life was slipping away. That is Ebola, not statistics, not projection, but people of Ituri. Today, WHO and Africa CDC launch a joint continental strategic preparedness and response plan. not as an academic exercise, but as a clear, unified course of action. Our objective is simple and non-negotiable: to stop Ebola, the outbreak where it is, to support the Democratic Republic of Congo and Uganda in their response, and to ensure neighboring countries are ready to detect and respond without any delay. Let me emphasize, Ebola responses succeed only when led at the highest national level. This must be government-owned, government-directed, and government accountable. Partners, WHO, Africa CDC, and others support and reinforce national actions. Countries lead, full stop. The plan reflects hard lessons written in lives lost and lives saved. So first, it is a shared, one plan, one budget, one team under the national leadership. Ebola exploits division. Unity denies its space. Second, it is practical. It focuses on what works: strong surveillance, rapid testing, timely care, infection prevention, and sustained community engagement. And third, it is a time bound from June to November. Why? Because delay costs lives. And fourth, it's fully costed, as you heard from DG, with a joint financial tracking mechanism to ensure transparency, accountability, and discipline. The plan strengthens national responses in affected countries and reinforces preparedness across borders where risk moves. WHO role is very, very clear: global leadership, emergency capacity, and coordination with CDC Africa, anchored in support to the national leadership, working alongside governments, supporting execution, never replacing the authorities. Let me end with this. Plans do not stop Ebola. People do. Protected health workers, decisive leadership, communities that trust the response. From Ituri, the message is unmistakable. I was there. When governments lead and communities trust, transmission slows down and outbreaks end. We know how to do it. We have the plan. Now we must act early together to end this outbreak with a very decisive speed. To DRC and to Sudan and to Uganda, we are not here to fight Ebola for you. We are here to fight Ebola with you. I thank you.
Thank you, Professor Janabi. Now the plan itself. The Director General of Africa CDC, Dr. Jean Kaseya, will walk us through the joint response, where the risk sits, what we are doing, and what we need. Dr. Kaseya, the floor is yours.
Thank you so much. Dr. Tedros and Professor Janabi gave us opening remarks. This is how we are sharing responsibilities. And I will make this presentation on their behalf. Let us start with what we know on the ground today. As we are discussing this slide, we need also to say that we are taking everything with caution because situation is moving and because we cannot say that we have the accurate figure, but from the national reporting that we have, so far we have 397 confirmed cases, 63 deaths, with a case fatality rate around 16%, 15.9%, and 5,009 people under contact list. We have also 11 countries at risk, but wanted to show you how this outbreak moved from day one, it means 15th of May when it was declared, to date. We moved from one province, 3 health zones, to currently 3 provinces in DRC and 26 affected health zones. And this is showing that the outbreak is moving, with the epicenter being still Ituri, where we have more than 90% of all cases and 70% of deaths. When some colleagues, they wanted to know why we saw this decrease in terms of suspected cases versus confirmed cases, we are showing that on the 29th of May, we were mostly led by the definition, the case definition given to health workers and community health workers. And based on that, we had around 1,351 suspected cases. But decision was made because we build capacity in terms of diagnostics to test all of the samples that were stored in Ituri. And the result we got, we moved from these suspected cases to confirmed cases. Today we are talking about 397 confirmed cases. And these 397 confirmed cases are part of the 1,000 samples that were in Ituri and INRB was testing. This is a clear explanation on suspected cases versus confirmed cases, because we know that some journalists were asking us on the change that we saw. But Dr. Tedros made it. Professor Janabi reinforced the message. I was in Ituri myself. As you know, I stopped my engagement with the World Health Assembly on the first day to land in DRC. This outbreak is very serious. You can see, if you compare with the 2 previous Bundibugyo outbreaks, number of confirmed cases and number of deaths, this one is the most serious Bundibugyo outbreak that we have so far. But we said, let us also compare with all other 5 serious outbreaks that we had. And as you know, WHO declared the 2014 outbreak in West Africa a public health emergency of international concern. It was also the case for the DRC outbreak in the eastern part of DRC. But let us stop. Let us take a photo. After 3 weeks of declaration, let us compare these outbreaks. You will see this current outbreak, the Bundibugyo one, is becoming the first one after 3 weeks in terms of confirmed cases. It's also serious in terms of deaths, but as we said, these confirmed deaths, we need to take it with a lot of cautious, because we still have more than 250 suspected deaths, and we need to test and to know if these deaths are related to Ebola or not. That one we can change the number of deaths we are providing, even the case fatality rate. Then, so far, if we rank the 20 outbreaks that we had in the past, this one is becoming 4th in terms of number of cases. But you can see the difference between this one and the 2001 in Uganda. If we continue to report cases in the next few days, that one will become the third one. In the past, when we were in Kampala,